Pregnancy pregnancy test in physiology practical. So what is the aim of PT in physiology practical? One is to detect the human chorionic gonadotrophin presence in urine for confirmation of pregnancy. It's used to detect the human chorionic gonadotrophin, that is in bracket HCG, in urine for confirmation of pregnancy. So what is the principle behind? Many people have shown you the pregnancy test strip. We've done the practical, you've seen it. I'm just trying to explain more. So the principle behind this is that after fertilization and implantation, the placenta secretes HCG. HCG appears in maternal blood and urine about 8 to 10 days after conception, after it has happened. Test kits use an immunochromatographic method, antigen antibody reaction, antibody reaction, and also if HCG is present, it binds with antibodies in the kit and produces a colored line which indicates pregnancy. I don't know if you get that. Let me start again. So the principle behind pregnancy, that's test that you deep stick that you dip in urine, because most times that is for home test, you dip in urine, which is what we did in the lab. I remember that. The principle behind it is that after fertilization and implantation, the placenta releases HCG into the maternal blood and urine, and this shows within 8 to 10 days after conception. And that kit, the pregnancy test script, uses immunochromatographic method, which is in layman's language, antigen antibody reaction. So if HCG is present in the maternal body, it binds with the antibody in the kit and produces that two-color line that shows to indicate pregnancy when you dip in the urine. So for the materials that will be needed, that you need pregnancy test strip or cascade, depending on the one you are using, a fresh urine sample, preferably if you are doing home test, early morning urine, okay, and the dropper for the cascade, a clean container. Of course, you have to wear your gloves. So basically, collect a fresh urine in a container, bring your urine or PT test strip, dip it into it and let it stay for about 10 seconds, and it shows one line indicates negative, while two red lines indicates positive. But in a case where the result is invalid, we have the test line and the control line. So when you dip it and only the control line shows, it indicates negative. When the test line shows alongside with the control line, it indicates positive. But in the case where the control line does not show and you have only the test line, indicates invalid, or where you dip it and nothing shows at all, it indicates invalid. So that is how to interpret this thing. So if peradventure we get a sample, a urine test strip that is from a pregnant woman, and we keep it, they should be able to know that, okay, when it's two line is positive, one line is negative. You wait for about 3 to 5 minutes before you read. So there can be some reason why there will be some error when you use the dipstick. Very early testing before HCG. So when you test before 7 days, before the 8th day, between 8th day to the 14 days after this thing, it might not, before it might not show, because some some test strip cannot detect HCG very early in pregnancy, while some even even 7 days after, 8 days after, they can pick it, even though the line will not be that bright, but it will indicate. So when you test early, also when the urine sample is diluted, expired kit sets, and improper test procedures, these are situations where you can have an invalid result even when the person is actually pregnant, because if any of these things go wrong, you may not get the accurate result. So precautions that you have to take or put in place when performing this experiment: use fresh early morning urine for better accuracy. Do not read the results after 10 minutes. After 10 minutes, it becomes useless. You don't need to read that. And follow the manufacturer's instructions clearly. So before you start it, read the instruction attached to it and follow it properly. So let me give you some few questions that you can see during the exam. And the first one is, what is pregnancy test? Pregnancy test is a diagnostic test used to detect the presence of HCG hormone in urine or blood to confirm pregnancy. What is pregnancy test? It is a test done to detect the presence of HCG, but remember, you have to write it in full. HCG hormone in urine or blood for detection of or confirmation of pregnancy. Another question that you could be asked is, what hormone is detected in pregnancy test? It is called the human chorionic gonadotrophin hormone, which is also known as HCG. Another question that you could be asked is, where is HCG produced? HCG is produced by the placenta after implantation of the fertilized ovum. Another question that you could be asked is, when does HCG first appear in urine? When does HCG first appear in urine? 8 to 10 days after fertilization, or shortly after fertilization, depending on how potent or how the test strip you are using is. Another question that we can ask you, or you could be asked, is, what is the principle of pregnancy, or behind the pregnancy test? It said it works on antigen antibody reaction, where the HCG in the urine binds with the antibody on the test strip, specific antibodies on the test strip, as simple as that. Another question you could be asked is, why is early morning urine more preferably? Because it contains the highest concentration of HCG, making the test more accurate. That is when you are trying to detect in early pregnancy, like before you even miss your period, actually. Because once you miss your period, it's obvious that it's going to, any urine you use during the day can show it. But in that early stage, and you want to do it at home, it's advisable that you use the early morning urine. So another question you could be asked is, what does the control line indicate? The control line indicates that the kit is working properly. Yes. What does the test line indicate? The test line showing indicates the presence of HCG hormone, suggesting the presence of pregnancy. What does one line at C means? It means it is negative. There is no HCG in the urine. What does no line at all means? Invalid result. Can pregnancy test give false positive result? Can pregnancy test give false positive result? The answer is a big yes. It can give a false positive. In such case, when there is trophoblastic tumor, when recent abortion or delivery, the hormones HCG is still in the system, it hasn't, or miscarriage, it hasn't cleared off from the woman's body. And also when taking some fertility medications that contains HCG, this also can give a false positive result. Also, can it also give you a negative false result? The answer is yes, when you test too early, before the 8th day. And even some pregnancy test strip cannot even detect as early as 10 days. Some is still after 14 days when you have missed your period. That's when some pregnancy test strip will be able to detect the presence of HCG. Also, when you use a urine that has already been diluted with water, it can give you an improper testing technique. Okay, the next question that you could be asked is, what are other methods that can be used to confirm pregnancy? What other methods that can be used to confirm pregnancy? We have the blood HCG test, which most times when you've done the home test, when you get to the hospital, they will do the blood test. And also you will be asked to go for an ultrasound scan to also show or confirm pregnancy and where the pregnancy is situated, because you know that sometimes the implantation can occur in the fallopian tube. Some persons I've seen cases where some persons had the fertilized egg implanting in the stomach, or in places where they are not supposed to be, outside the uterus. So okay, I think that is that for pregnancy tests. If you have any question, you can drop in the comment section and I will gladly answer you. So let's